My name's Paula Fletcher. I'm the City Councillor for this area of Toronto Danforth, Ward 14.
Yeah. So you know the COVID-19 cases keep going up every day. So is the city ready or any caution for the
It's the public health that is looking after this on behalf of the citizens, and the medical officer of health for the City of Toronto and also for the province of Ontario. And it's very important to get the message out. Today's message is wash your hands, always be washing your hands constantly, all day, and to prepare just in case you have to be quarantined or self-quarantined. So people might not be ready to spend 14 days inside their home. So that's what people need to do, is prepare for that. The cases are not going up dramatically at this moment, but it's always good to be prepared just in case.
So look at the city, say about a hospital or the medical professionals of the city. They have a special, today, federal, they have a special team from the minister to form it, to call a cabinet committee to handle the COVID-19. Is that a similar, task force in Toronto?
Well, the medical officer of health and the board of health and Councillor Joe Cressy, who chairs that, are meeting constantly. And I think the federal task force, that needs to be struck because people are coming from other countries, so they need to be very aware of where people are coming from into the country, into Canada, and then they pass that information down to the local health authorities. So our team in Toronto was always ready for these large possible pandemics, and they've been working on all the preparations. Right now, tomorrow, I'm going to get the pamphlets from Public Health and then bring them to the pharmacy here that Andy can hand out to tell people, wash your hands, get ready, prepare in this way. Don't worry, because it's not a pandemic in the City of Toronto, but just in case, we need to be thinking about prevention and preparation.
So the hospital is ready. The hospital in Toronto is ready in case there's an outbreak right there.
I believe that the hospitals are. Remember, last time they were caught off guard during SARS, and now they've had a chance to look at all their procedures and get prepared, and people know what the symptoms are, and the medical profession also knows what the symptoms are.
So last question. The City Council also put an eye on this issue.
City Council gets the regular reports from the Board of Health, and we get updates just about every day as to what preparations and what prevention measures need to be taken and how ready we are. And I think that we're as ready in the City of Toronto as we can be. We've been through a big issue before with SARS, so our teams are ready.
People have trust and confidence on government.
I have confidence in the Toronto government, and one of the concerns, though, from the Board of Health was the cuts that the provincial government, the Ford government, has made a lot of cuts in healthcare and also in public health. So this is a very big concern, because cutting public health at a time that we're looking at pandemic or this virus coming, that really it's public health measures that will prevent it. So we are calling on the Ford government to reverse their public health cuts, and I think that's one of the most important things that we can do.
So they say yes now? Or?
No, they haven't said yes, but they have to take it seriously. If they don't, then they're not allowing everybody to be prepared in case this turns into a very, very broad spread dreadful disease.
Thank you so much.
Thank you.
Very modern, too modern for Andy.